All right, well, as you have heard, some parts of Gauteng are still without water, apart from businesses and livelihoods that are affected. The country is not out of the woods yet when it comes to COVID-19 pandemic. In fact, coronavirus cases have started going up again as the country braces itself for the fourth wave of infections. What implications will these water cuts have on COVID-19 cases in the coming weeks? Let's bring in health activist Dr. Kgosi Letlape. It's always a pleasure having you on the show, Dr. Letlape. Thank you very much for giving us your time as usual.
Good afternoon to you and the viewers.
We have been told, Doctor, to brace ourselves for the fourth wave of infections. Initially, we're told, the early parts of December, then we're told the later parts of December. Now, we're also experiencing this issue of water cuts in Johannesburg. And in fact, in the country, we're experiencing a lot of issues when it comes to water. And one wonders, we've been continuously being told to wash our hands, to sanitize and so forth. How are we going to do that when there's no water? There's no water for us to do so. And I wonder how it will then affect the situation that we're already in, as we are still in the pandemic.
I think fortunately with the water cards in Gauteng, Rainwater warned us and told us to store water. We've not always had piped water in our lives, but we've always been able to fetch water from the river or from the well and store it. So it will be in the interest of all South Africans, particularly if in a water scarce area or when there's a possibility of water being cut, that we store water. Fortunately, we do not need large quantities of water to wash our hands. It's not like taking a bath or taking a shower. So we should just be prepared and live within the conditions that we are exposed to.
Doctor, the NICD says that the fourth wave is expected to be substantially lower than in previous waves. What exactly does this mean? What do they mean by this? And should we be less or more worried about this fourth wave? I think there's been conflicting messaging in terms of how we should view this fourth wave, and perhaps you can weigh in on that.
Well, we haven't seen any variant of concern at this point. We haven't seen anything that is highly infectious or an infection rate that is going up. It is on those bases that they are cautiously optimistic that the wave might be better than the third wave. And what they would be referring to, it would be the peak, the number of cases that we would have, and the severity of disease, the number of people that would end up in hospital, and the impact on our ICUs. They are predicting that should be less than what we've had before. But that would be dependent on us not getting a variant of concern that comes up in the fourth wave.
Doc, Rainwater told us, not to stockpile water during this time. And I suppose for many people, many of us, it was difficult not to be tempted to, in fact, stockpile on water. But I'm also just thinking about people who live, let's just say, in squatter camps, for example, where water is already a crisis. You'll find a situation where many homes are sharing one tap, for instance. So when you say that, okay, we were given adequate warning and so forth, but Doctor, we have the reality of people that are living in poverty and might not be able to make certain storages of water for prolonged periods of time, maybe a day or two, but after that it does get a little bit tricky for them. And I wonder what your views are in that regard when it comes to the issue of us still dealing with COVID-19.
I think we've got to get to a point where as South Africans we lift ourselves. And it is extremely unfortunate to be in those difficult circumstances, but that's the reality that they have. And fortunately, what we have seen is that those that are poverty-stricken are extremely innovative and resourceful. And I'm saying to them, take matters into your own hands. It's your own life. Try and get sanitizer, try and get as much water as you have and soap to be able to clean your hands. It's amazing. A study was done quite a few years ago in the north on hygiene. And once people are informed, they become resourceful, they become dependent on each other. It does not excuse us as privileged South Africans from ensuring that every South African, where possible, has piped running water in their own yard. That's the minimum we should deliver so many years post-independence and post all of us having the right to vote.
Yeah.
We have a collective responsibility to uplift each other.
All right, Doc, always a pleasure. Thank you for being with us once more here on SABC News.